Hi, this is Craig Brocky from craigbrocky.com, sharing with you the secrets to being happy, healthy, and wealthy. We're going to spend a few moments here talking about structural balance. And we're going to talk about a really breakthrough and exciting technique called Neurocranial Restructuring, or NCR, and how your body feels. A lot of people live with chronic pain, and there's several reasons for that, but one of them is structural. I'm going to show you something that's very simple that you'll be able to recognize in yourself and other people. Okay, the thing about neurocranial restructuring is it deals with your head and how your head sits on top of your spine. Okay, I'm going to teach you something that you'll get the eye for very quickly. And there's three common back issues that people have that cause a lot of back problems, and they may or may not be aware of it. One is hunchback, or kyphosis. One is called swayback, or lordosis. And one's called scoliosis, which is actually the curvature of the spine that generally relates to some sort of twisting. Now, a lot of that has to do with your head and how your head sits on top of your spine. Your head sits on top of your spine similarly to a 8 to 10 pound bowling ball would sit on a pool cue. Okay? And if that bowling ball or your head is a little bit out of alignment, for instance, if my head were a little bit out of alignment this way, all these muscles in the back of my neck have to work all day long just supporting my head. And generally what we'll have in a situation where your head is forward like this is you'll have your hips come forward a little bit as well. So when your head comes forward, oftentimes everything comes forward, and your hips will come forward to balance where your head is at. And this is what's called hunchback, or kyphosis. And that's when basically your head is too far forward, and you'll notice these people really easily. Hunchback is really easy to notice, but the person's head comes forward, they get hunched, and you'll notice that their butt comes forward as well to counterbalance that weight. And these people are easy to spot because hunchback's pretty obvious, but the next time you see someone who's hunchbacked, look at their butt, because you'll notice that they don't really have a butt because it's so far forward, balancing out their weight distribution. Okay, the next thing is swayback, or lordosis. And swayback's quite the opposite. It's when your head's too far back. And typically these people look like they have really good posture, but what typically happens is their head is too far back, oftentimes cocked up a little bit like this, and because their weight's back, their hips come back as well to, again, balance that weight. And as a result, you'll notice that these people oftentimes have a more pronounced butt, and they have oftentimes lower back pain because there's a lot of stress on the lower back here. So again, here in this situation, you want to just bring that head a little bit forward and get the angle right on it, and then the whole body can relax underneath it. Scoliosis is a different situation. Oftentimes your head is just a little bit off to one side and maybe forward a little bit. That can cause twisting at the spine. The hips usually follow where the head goes, so if the head's a little bit to this side, typically the hips, I'm exaggerating, but if your head's a little bit to this side, your hips will come to this side as well to counterbalance. If your head's back a little bit, the hips typically go back a little bit to, again, align the weight distribution. If the head's a little bit forward, your hips come forward, and you don't have a butt. So balancing this out, though, if you can just get the head right back in the right spot, what miraculously happens is the rest of the body falls into alignment, and a lot of the chronic pain problems go away. So what I suggest you do is you visit ncrdoctors.com and try to find an NCR doctor in your area that you can consult and see if this is a therapy that might be right for you. I personally have had many NCR treatments. I could show you before and after treatments of how my eyes were, slammed shut from different injuries. My head was off to the side. I used to have moderate swayback, some scoliosis, used to have chronic neck and back pain, and most of those symptoms have disappeared through NCR. The other nice thing about NCR is it tends to balance out the facial features. It brings your cheekbones forward, helps balance out any kind of indentation you might have in your temple area. And it just balances out your facial features and actually ends up making you look more attractive and increases your self-confidence. So there's a lot of good things that can come out of an NCR series of treatments. NCR was developed by Dr. Dean Howell. Dean Howell is the founder of a technique called Neurocranial Restructuring, or NCR, and there's nothing that I could more highly recommend for structural improvement. Another benefit of NCR is it tends to improve mental clarity. Dr. Howell uses a great analogy, I believe, and that's that your brain sits inside your skull. If your head were out of alignment, it'd be like having a round sponge in a square box. So if you feel your head and there's areas of indentation or ridges, what ridges are there's different plates in your head, and if the plates overlap, what you get is a ridge, and it's kind of like a mountain range. You're having two plates overlapping, which are creating a ridge. Or the other things you might have is, you might notice a lot of people have indentation here in their temple area, and oftentimes that's created by a forceps delivery, but it can be caused by other reasons. But oftentimes people have chronic headaches, migraines, or mental fog. They'll have some area of compression or an area where, say, there's a ridge or an indentation that's actually putting a little bit of pressure on the brain. And what's happening is that the cerebral spinal fluid flow and the blood flow in your brain is constricted in those areas where there's compression. So through NCR, you're actually rebalancing the bones and you're removing those restrictions on your brain. So typically the brain works more effectively. It's very cutting edge, although it's been developed over the last 25 years by Dr. Dean Howell, and now several doctors across the United States and Canada provide this service. Even people like Kevin Trudeau, who are very up on natural techniques, have yet to discover this treatment.